Hi, Dr. Wade here, physical therapist with Physical Therapy and Balance Centers of Louisville, Mississippi, and I'm here to talk to you today about how you can determine your risk for back pain and also why you may still be having trouble with your back pain even after you've had, say, physical therapy, chiropractic, acupuncture, massage therapy, injections, exercise, the works, but yet you still have problems with your back or your sciatica. What can we do to determine why? There's a simple test that we'll show you how to do right here. This is our trusty model, Lisa, and let's get to it. So first thing you want to do is determine which one's your bad side. If you have sciatica, you already know which side's your bad side. If you don't know which side, if it's right across the center of your low back, then what you do is you just stand on one leg and stand on the other. Whichever leg you have less balance on, we're going to call that your bad side. Lie on your good side, so the bad side is up. You take your bottom leg, push it straight, let the top foot just simply relax right behind your knee. Okay? Now you can do this on the floor if it's a carpeted surface or on a firm mattress. If you have trouble getting up and down off the floor, I don't recommend you do that. In fact, watch our next video and we're going to get into why you're having a problem with that and how that relates to your lifespan. So that's a good one. Be sure to watch the next video. On this one right here, what we do is you want to make sure your shoulders stay still. We're going to measure how far you can get the little bone in the front of your hip here. It's called the ASIS. That bone, we're going to measure how far you can get that bone to the mattress. So she slides forward as far as she can go without causing pain. And you should be able to get within about 2 inches. If you can't get within 2 inches, you have a limitation there. There's a problem. You found it. And then she slides it back. Good. One more time. She rolls her hip forward, seeing how close she can get. She relaxes her thighs here. And then we see how far that is. So that's a good 2 inches right there. Nice. It doesn't matter what your age is. It doesn't matter what your body shape is. Even when you're pregnant, you can do this. Even if you have a large mass, if you're overweight, you can do this. It doesn't matter. So if you find that you can only go about half or 25% of what we would consider normal, or just half there, then that's going to be limited. You're finding your problem. No matter what kind of treatment you get, you're going to be predisposed to having back pain or sciatica. That has to be fixed. How do you fix it? First thing I would recommend doing is simply calling your local physical therapist that's trained in manual physical therapy. This is not something you can crack out. This is not something you can work out and exercise at. It needs to be specifically addressed. First of all, you need to find, do you have that problem? So now you know how to test yourself. So I hope this has helped you determine possibly why you could be having a persistent back problem or whether you have a looming back problem there, okay? So I'm glad I could speak with you today. I look forward to seeing you in the next video. This is Dr. Wade Baskin, and I'll see you soon.